120 days. However, we also may see variation in the daily numbers for different reasons, including reporting delays. As such, we will know better if this trend becomes a stable downward slope over the next week. While the data are moving in the right direction, context is important because cases, hospital admissions, and deaths all remain high and well above the levels that we saw in the summer and early fall. In order to keep these trends moving in the right trajectory, we must continue to wear masks, continue to social distance, avoid travel and crowds, and get vaccinated when it is your turn. And I want to underscore the importance of mask wearing. Today, CDC will be releasing 2 reports in the MMWR that describe the decline in COVID-19 hospitalization growth rates when statewide mask mandates are in place, as well as a study detailing face mask use among college students on college campuses with mask mandates. Finally, I want to highlight another dimension of the COVID-19 pandemic on society, specifically the impact on mental health and substance abuse. Yesterday, CDC reported a study in the MMWR among US adults and found that 28% reported symptoms of depression, 8% reported suicidal thoughts, and 18% reported they had started or increased substance use to cope with emotions during the pandemic. The study also found that these outcomes were higher for some racial and ethnic groups, including Hispanic adults. This study underscores the need to ensure that the response to the COVID-19 pandemic includes attention to behavioral health needs of communities. And it reminds us that the longstanding systemic health and social inequities have put many racial and ethnic minority groups at increased risk for poor health outcomes, including COVID-19. And it underscores the need for health equity to underpin everything we are doing in response to this pandemic. Thank you. I'll now turn it over to Dr. Fauci. Dr. Fauci.
Thank you very much, Dr. Walensky. What I'd like to do in the next couple of minutes is just to bring you up to date on one of the issues that we discussed at our last briefing, and that is the progress along the way of the J&J on the basis of the data from their ensemble trial in getting the information to the FDA, examining it in preparation for the possibility of an emergency use authorization. The data are now with the FDA. They are examining it. They have scheduled the advisory committee, their VRBPAC, the Vaccines and Related Biological Products Advisory Committee, which will meet in 3 weeks. So let me just very briefly review for you where we are and where we hope to go. As you know, the data on efficacy of this ensemble trial, which involved 3 countries, the United States, Brazil, and the Republic of South Africa, showed an overall efficacy of 66%. But when you unpacked from the different countries, you had a 72% efficacy for mild to moderate disease in the USA. In the Republic of South Africa, which, as you know, is of concern to us because of the mutant and the lineage that is now dominant in the Republic of South Africa, namely the B.1.351. In that, the protection against moderate disease was 57%. But the good news is that when you looked across all of the countries, the protection against truly severe disease was well over 80%. In fact, about 88.8%. Also of interest is that in the South African study, as well as all of the others, there were essentially no hospitalizations or deaths. So the sobering news is that we are dealing with variants, antigenic variation, which does have clinical consequences, as I mentioned on the last press briefing, of escape from some of the monoclonal antibody protection and a diminution in some of the protection that we have from the current vaccines. But the somewhat encouraging news is the rather complete protection against very severe disease, including hospitalizations and deaths. Now, when you look at what's going on in our own country, clearly, as the days and the weeks go by, you see, as predicted, an increase in the prevalence of the UK variant, the B.1.1.7 in the United States, which, as you well know, has been shown by the Brits to have an increase in efficiency of transmissibility, as well as a recent paper showing that there was some increase in pathogenesis leading to severe disease. So this is something that we will have to deal with because this is something that's expanding in its prevalence in the United States. The point that I want to make and end with is something that I said last time that I really think it's important for us here in the United States to realize, that the evolution of variants occurs only when you have a certain degree of replication of the virus in the community. And that means spread from person to person. Viruses will not evolve and mutate if you do not give them an open playing field to replicate in essentially an unbridled fashion. For that reason, the message that we keep giving, that Dr. Walensky and I and others on the team keep giving, is that now is the time to do a couple of things. One, double down on the adherence to the public health measures that we talk about all the time, the uniform masking that the president has spoken about, the physical distancing, the avoiding congregate settings, particularly indoors, and the washing of hands. At the same time as another very important mechanism of dampening down the replication in a given community is the distribution efficiently and effectively of vaccines. You'll be hearing about that in a moment, but the message that we have, when a vaccine becomes available to you, get vaccinated. You will not only be protecting yourself, your family, but you will be making a major step in a positive way to protecting the community. I'll stop there and back to you, Andy.
Thank you. Tim?
Thank you, Andy. Thank you, Dr. Fauci, Dr. Walensky. So first, since I may not be as well known as Drs. Fauci and Walensky, please allow me to introduce myself. My name is Tim Manning. I'm the National Supply Chain Coordinator for the COVID response. I'm an emergency manager, having done disaster and emergency response for the past 25 years. And I've worked at the local and state level and served as a deputy administrator at FEMA for 8 years. I've also been a firefighter and EMT, and I know firsthand the importance of having the equipment and supplies you need when you need it on the front lines of a crisis. Right now, I work with teams across the government, from Department of Defense to the Department of Health and Human Services, to ensure our country has the supplies we need, not just now, but into the future. That's why on day one, President Biden signed an executive order directing us to use all necessary powers, including the Defense Production Act, to get this pandemic under control. In fact, the administration identified shortfalls in 12 critical categories of supplies. And today, I'm announcing 3 ways in which the administration is using the Defense Production Act authorities to fight this pandemic. One has an immediate impact. One will be felt over the next few months, and one will help diminish our reliance on foreign manufacturing for PPE over the long term. Our first action gets Pfizer more equipment and supplies that are enabling them to ramp up production and deliver more vaccine faster. Our second action will deliver more than 60 million point of care tests or at-home tests by this summer. And that's in addition to the news Andy announced on Monday about the Ellume test. Our third action will help America produce more surgical gloves that our frontline workers desperately need. So let me start with increasing vaccine production. Since January 20th, we've increased the vaccine supply we are providing the states by over 20%. Right now, one of the factors constraining increased manufacturing of vaccines is limited equipment and ingredients. That's why we're leveraging an important power of the Defense Production Act, the ability to ensure that supplies and material critical to our national defense are going to areas of greatest need. This is called a priority rating. If the federal government puts a priority rating on a contract, it means that company can, say a vaccine manufacturer, gets first access to the product they need before anyone else. Today, we're announcing we're expanding the priority ratings for Pfizer to include filling pumps and tangential flow filtration skid units, critical components Pfizer needs to manufacture the COVID vaccine. It's actions like these that will allow Pfizer to ramp up production and hit their targets of delivering hundreds of millions of doses over the coming months. We told you that when we heard of a bottleneck on needed equipment, supplies, or technology related to vaccine supply, that we would step in and help, and we are doing just that. Second, we're using the DPA to increase our supply of at-home COVID tests. The country's well behind where we need to be in testing, particularly the rapid at-home tests that will allow us all to get back to normal activities like work and school. Earlier this week, we announced investments to bring the first non-prescription at-home COVID test to Americans. And I'm pleased today to announce that over the coming weeks, the US government has plans to invest in another 6 suppliers to rapidly surge domestic testing capability. And thanks to this action, 61 million point of care or at-home tests will be available by the end of this summer. To do this, we'll help industry partners construct new plants and build new production lines here in the United States, bringing critical capacity to the fight and reducing our vulnerabilities to disruptions in the supply chain. And third, we're very focused on procuring the personal protective equipment, or PPE, to keep America's frontline healthcare workers safe. There's a grave need for masks, shields, and gloves, and we currently aren't producing these at the rate we need in order to keep up with demand. We're already working to increase the availability of N95 masks to frontline workers, but another critical area of concern we hear over and over is surgical gloves. Right now, we just don't have enough gloves. We're nearly 100% reliant on overseas manufacturers to export to us, our country's surgical gloves that protect healthcare workers. And that's unacceptable, and we're using all of our authorities to fix it. Over the past 2 weeks, we've pushed forward an effort to expand domestic manufacturing of surgical gloves. And I'm pleased to announce that we will build plants to make the raw materials, the nitrobutyl rubber for surgical gloves here in the United States, and we'll help build factories to make those gloves right here in the US as well. And by the end of the year, we'll produce more than 1 billion nitrile gloves a month right here in America. We'll now make enough to satisfy half of all the US healthcare community demands right here on US shores. These are just 3 examples of how we're using the DPA strategically and effectively in our national response, and there's more to come. I know there's a great deal of interest in exactly where and with whom we're contracting. For reasons of procurement law, I'm not able to disclose the ongoing contract negotiations until they're finalized. Efficient contracts take 4 to 5 weeks to finalize, and we're about halfway through. So over the next few weeks, I expect we'll have more announcements about the ways we're using the DPA and other tools to combat the virus. Now, I want to end by encouraging Congress to act, because some of our additional plans to use DPA, including adding more domestic genomic sequencing, allowing us to track variants and see new ones, or ramp up molecular tests, require funding. Congress could help this effort greatly by passing the American Rescue Plan. And with that, I'll turn it back over to Andy.
Thank you, Tim. So why don't we go to some questions?
All right, thank you, everybody. First, we're going to go to Peter Sullivan at the Hill.
Hey, thanks. I wanted to ask on rapid testing. I hear the announcements you're making. Some people have pointed to the FDA as sort of a bottleneck on the rapid testing and say, you know, they're not authorizing. They're maybe taking too conservative a view of accuracy, comparing it to PCR, and not kind of authorizing simple rapid tests that can be, you know, millions per day, maybe even more plentiful than what you're talking about. So I wonder, I mean, is there any consideration of either creating a new approval pathway at the FDA or taking more steps to kind of authorize even more plentiful rapid tests?
Yeah, thank you, Peter. Look, we understand that everybody who has something submitted to the FDA wants their product approved. And, you know, I would only observe, having been around the FDA for quite some time, that when they go fast, people criticize them. When they go slow, people criticize them. And I think we should be delighted with the announcement today, which I think is a counterfactual to the question. Having 60 million more at-home tests available over the course of the summer is exactly what the country needs. I think it will change things pretty significantly. So I'm very excited about this announcement, and I think many Americans hopefully will be as well.
Great. Next, we'll go to Michael Wilner at McClatchy.
Thanks for doing this. 2 questions from me. First, the Pentagon just announced it approved 1,110 active duty service members to support 5 FEMA vaccination centers. Can you tell us where those vaccine centers will be? And secondly, the national strategy says that the administration plans to accelerate the pace of vaccinations by encouraging states to move through priority groups more quickly. So what does more quickly mean? Can you be specific what your guidance has been to states thus far? And if you're leaving it to states to manage, what about your guidance is different from the prior administration, which also endorsed the ACIP guidelines?
Yeah, thanks for the question.